I was the only child, and my mother died from diabetes at 61, and Dad died at 66 from cancer. His dad died at 66, and his brother died at 66. The only family I got is really here.
Stephen came in mostly with a lot of issues with his feet, but what he was really needing was somebody to help manage his diabetes and help manage all of these specialists that he was seeing.
I was in pretty bad shape when I come here. My diabetes was in bad shape. I don't have hardly any toes or any feet left on either foot. I was next to death, I guess, because I had been on vancomycin for so long and I'd lost over 100 pounds.
A lot of his care was also very fragmented, and so he was seeing like endocrinology who didn't talk to his podiatry, who didn't talk to wound care. And so not having a good primary care provider to help him manage all of those things, I think was part of the big reason why he was in the hospital so much.
People who aren't able to have insurance in the first place are often people who have the hardest time paying for those high bills.
My husband lost his job 12 years ago, and we lost a really good insurance package at that time, and it's taken us a long time to recover. We're the type of family that makes too much to receive any help, but not enough to be able to afford private insurance every month.
She was like a lot of patients who come to us. She had not had access to regular health care.
I've always been leery of asking for any kind of help because I don't want people to assume that I don't work hard or we don't work all the time, that kind of thing.
Every day I see someone who would otherwise be going to the emergency department in a month or a year or in 10 years.
I had some things that I needed to take care of. I actually turned 40 and fell apart. And so I've been at Blue Ridge Health a lot. And so they were able to patch me through to specialists that I would have not taken these tests. I would have waited till an emergency.
I worked in emergency departments for several years before moving into primary care. And I think a typical ER bill is somewhere around $3,000. And a lot of the times, these are problems that could have been dealt with in 1 or 2 or 3 primary care visits.
And one of the things that I have been struggling with, I have on and off my whole life, is depression. And it's not something I'm proud of, and it's not something that is my favorite thing to talk about, but I felt that I needed to mention it because without Blue Ridge Health, I would have gone untreated. And it had been for too long. I waited too long to go to the doctor because I didn't know that it existed.
And it's easy when you're caring for other people and covering other needs in your life to let some of those less urgent but very important things slip.
It just went untreated. I didn't have the money to go to the doctor, and I thought, you know, this is dumb. I should be able to snap out of it and get going. And the first time I talked to Dr. Bentley, he just reassured me that I did the right thing by coming. And from that reassurance to today, I've seen a total turnaround in my life. I've got a new job, I have a better outlook, and I'm able to go out and be back to my best self.
They've taken really good care of me, and they see me probably once or twice a month anyways. And I can tell you that I have no family really except my family here at Blue Ridge.
Blue Ridge is a patient-centered medical home, which means the patient is at the center of everything we do, and we try to make this a place where all patients can receive all the care needs that they need, hopefully within the same building.
I see people come in and they look like they've had this huge weight lifted off of them.
From the first visit, you realize that these people are for real and they really do care.
You couldn't find a better bunch of people to take care of you. They're just the best there is.
So many patients come here obviously seeking better health, but we know that that's only one component of what they really need to be healthy people.
I don't know what I'd do. I'd be lost, I guess.
So we're able to help navigate their other needs, so whether that be housing or food scarcity.
Keep striving to make me feel better and better when they do, every time I come.
I'm really thankful for Blue Ridge Health because for me it's been a little bit humiliating to have to need the help, and they've treated me with honor and respect, given me quality care, so I feel like I have dignity.
You can see it on people's faces when they feel like they're getting care.
They care about my family, and they helped me in my time of need, and I would do anything to give back to what they've given my family this year.
You know, whatever they need me to do, if I can help them out in any way, I'd be glad to. And there's nothing I wouldn't do for them here, not nothing. I've got out of my way for them. I mean, if they need a place to stay and we're homeless, I'd tell them to take the bedroom, I'll sleep on the couch.
Sometimes when you're looking for services that you can't afford, like maybe you're looking for some health care, you think that it's people that are obvious, that look like, oh, well, they really need some help. A lot of times you don't know what it looks like when people need help. People are always going through something. So it could be your neighbor, it could be your family member, and it may even be you one day.
Great service for the community, Blue Ridge does, and the people that work here. And I thank everybody that's donated their time and money to this place.
So even though I'm also an employee of Blue Ridge, I donate because I know that the amount that I donate will be multiplied many times over with the way that Blue Ridge as a whole, as an organization, and particularly within our clinic, handles those funds.
Certainly had the benefit of me by leaps and bounds. I can't thank them enough.
If we want to have more stability in our own lives and our own communities, we do better to have strong neighbors. If the people around us have what they need, that makes everything better around us.
I really appreciate the help now, and I can't wait till I'm in a better position to be able to give back.
So that's why I go to, they take care of me, and I try to do whatever I can do for them. Great thing to be part of, and I'm sure glad for all the people that donate to make this place possible.
It's a family, really, when I go over there. And the people at my office, I know feel that way. I've gotten to know some of the other patients and talk to them about their stories, and so it feels more like we're involved in a great community that's doing a really good thing. I mean, I've lived around different places, and I have never found a clinic that runs quite like Blue Ridge Health.